Everything's recording. People should start coming in. Should have had some background music going.
Yeah.
As soon as they start coming in, I'll spark it off.
It still says we're in a practice session.
Does it?
Mm-hmm.
Oh. Enter a new name below. Now, why would I do that? Well, let me hit stop recording because I don't want to put this on the website. Now we got people coming in. All right, everybody. Hello, my name is Dwayne Ellis. I'm a person in long-term recovery, and what that means to me is that it's been 6 years since I felt the need to use any mind-altering drugs to change the way that I feel. Simply put, recovery has awarded me the opportunity to live my truth and be proud of it. Welcome, everybody, to the May webinar, where GCSA's North Georgia Community Connector staff will be talking about self-care while supporting the peer workforce. But before we get into that, let's go over some housekeeping really quick. Those who stay for the entirety will earn 1.5 CEUs. When submitting your CEUs, keep up with the month, the topic, and the panelists, which in this case would be May for the month, self-care while supporting the peer workforce as the topic, and NGCC staff. That's short for North Georgia Community Connectors. I'll put all of that in the chat though, so you don't have to worry about it right now. You'll receive a certificate for this training no later than the end of next week from Tia Morgan. So be looking for that email from Tia Morgan, and you could take that attachment and add it to the JOT form when you have to submit your CEUs at the end of the year. You'll be muted throughout the entirety of this presentation, but you can put your questions in the chat or Q&A box, and we will try our best to answer all the questions. Also, this will be an interactive webinar, so there'll be plenty of opportunities to share your experience and become a panelist and have your face seen and everything like that. So we're doing things a little bit different this time. But with that said, how are you today? So if you want to put it in the chat, I am blank, however you're doing, and we'll start reading those off. And we may call on a few people just to, you know, tap in with all the cares that we have. I see Brittany Coleman, cares 31. I'm grateful. I'm doing great. What else we got? I'm tired and stressed, honest. Thank you, Daniel. That's awesome. Cares XXX. I wish I could read Roman numerals. I'm encouraged. I'm blessed. I'm tired. I'm tired. Thank you, Anthony. I'm blessed, but have 2 broken ankles. Wonderful. Hello, Cares 39. Hi, everyone. Cares 10 is here. I graduated with my MSW Friday. Congratulations. All because of recovery. Joni Cares 22, recovering from COVID. Go Miranda. So if anybody that's in here right now wants to raise their hand, we can actually promote you to being a panelist, and you can share with us really quick how your day's been going, maybe more in detail. Let's see if we got any hands raised. Cares 30. The thing about Cares, everybody want to shout out their cohort when we all know that Cares 38 is probably the best.
Mm-hmm.
So again, if anybody wanted to raise their hand and maybe share with the group how their day's been going. Daniel said, prove it. Daniel, come on and be a panelist so we can hear from you. Tell us about your day. Isidore, raise your hand. Somebody up, there goes Daniel. Let me promote you. Promote the panelists. He should be coming on. Daniel, where you at? I don't see you. I'm open-minded today. Cares 22 rocks. Cares 29. I'm Sarah Foster. Hey, Sarah. There goes Daniel. What's going on, Daniel?
What's up? How's it going, everybody?
Going good. How about you?
I thought I already said that. Tired and stressed, but life is good though.
Nice, nice.
I don't
Like-
like looking at myself on camera. It's very strange.
I don't either. So what's been going on throughout your day that's caused you to be tired and stressed, I guess? Tell us a little bit about your day.
I mean, I have really nothing to complain about. A lot of good things are going on in life. I think a lot of it is just not having the time to stop and do the self-care, take care of myself, which is what's always important in this line of work. I've just been going all week, driving all over the state and stuff like that. I just found out my uncle passed away, so that's kind of sad. And so just the regular life stressors, dealing with everyday life stuff and trying to run a business on top of it. And yeah, but I think I'll get a little break this weekend. I'm going away. My cousin got married during COVID and the reception this.
Nice. My condolences and thank you for sharing your experience and being willing to do this. And this is probably the right webinar for you. If anything, what you'll get from this webinar is that you're not alone. So thank you for that, Daniel. And I'm gonna put you back in the attendees.
Okay, cool. I don't have to look at myself.
All right, does anybody else want to share? Anybody? All right. Well, without further ado, I want to introduce our facilitators today. We have Ashley Stevens, the NICU program manager. We have Don Molinax, the ED program manager. Renee Smith, the B Corps program manager, and Jeremy Moore, the AUD program manager. These are all people in recovery with these leadership positions. It's awesome to see, and thank y'all for being able to do this. And I'll turn it over to whoever wants to go first. It's on y'all.
I'll go ahead and go. So good evening, everyone. My name is Ashley Stevens, and I'm a woman in long-term recovery. For me, it's been 15 years since I felt the need to use any substances to cope with life. For the past 4.5 years, I've had the opportunity to work for the Georgia Council on Substance Abuse. I started out as a recovery coach in the emergency department and eventually became team lead over that program alongside Dawn, whom you will hear from shortly. Dawn and I led the emergency department team together, and eventually she became manager over that, and I moved into the role that I'm currently in. I'm the program manager for one of our other direct service teams within the Northeast Georgia Health System. We see moms who deliver in Gainesville and Brazelton at Northeast Georgia Medical Center. And while we have seen a lot of successes, we have also seen a lot of emotionally draining situations. So I can remember a time very early on, as the NICU was getting started, I got a phone call from one of our community partners. She works with an accountability court here in Hall County, and she was working with a young woman who was pregnant and still actively using substances. After a few conversations with her, we were able to talk to her, and she agreed to go to the hospital. When she was at the hospital, she was very uncomfortable. She didn't feel good. She was having withdrawals, and she was 8 months pregnant. So I say all that to give you guys a little bit of a background into that story. But if you fast forward roughly 8 months or so, I'm coming out of church one Sunday, and this girl approaches me. And I had noticed her earlier in the day, and I thought she looked familiar, but I wasn't too sure. So we get to talking, and anyway, she shares with me that she remembers where she knows me from. And I don't know if any of you guys are like me, but anytime someone says that, given the past that I have, I always immediately think like, oh my goodness, what are they fixing to say? And she says that I come to see her in the hospital. And let me just say, she looked like a completely different person, but everything started coming back to me. And she had stopped using at that point. She delivered her baby and she has remained in her recovery. At that time, it was like 6-7 months. But she wanted to thank me for being there with her and supporting her. And to this day, she is still in her recovery, living and thriving in her life. This is just a small piece of the good that we do see. So being the manager over the NICU Peer Recovery Coach Program, I oversee the peer coaches who work within the Women and Children's Pavilion. I have the honor to lead these women every day in their efforts to support the moms they see in finding their recovery or support them in continuing their recovery. They walk alongside each mom to connect them to any resources they may need, help them navigate their defects cases, be a listening and supportive ear, and sometimes a shoulder to cry on. The NICU Peer Recovery Coach Program went live in November of 2018. And to date, we have seen a total of 774 moms. As you'll see on the slide, I have 3 coaches, Alexis, Demetra, and Danica. These are the wonderful ladies that go in and be there for those moms. Thank you guys for letting me share a little bit about what I do. And at this time, I would like to turn it over to Dawn, where she will give you an overview of what she does.
Hey everyone, thank you, Ashley. So my name is Dawn Mullinax, and I'm a person in long-term recovery. And for me, that means I have not used illicit substances for 15 years or self-injurious behavior to change the way that I feel. I'm committed to my recovery because it has given me the opportunity to be present for my own care and wellness. Also, it's given me the opportunity to work and train in the peer workforce since 2011. I began my professional peer support career at GMHCN's Cleveland Respite Center. Then I worked for the Georgia Region 1 Benchmark Mobile Crisis Team. Followed up and also had some experience with working in the Northeast Georgia Drug Court System. And in 2017, I started working with the Georgia Council on Substance Abuse. And today I'm grateful to be serving as one of the program managers of the Northeast Georgia Community Connections Recovery Coach Program inside of Northeast Georgia Health Systems. The emergency department team that sees people with substance use disorder now has a total of 5 coaches. We have, as you see here, Jody, Winona, and we have Scott and Alexis, who just started this week, and myself. We have seen a total of 6,700 peers in the emergency department since the start of our program in 2017. What our program does is when we receive a call from the hospital staff, we go and we make an in-person connection with a peer inside the ED. This opportunity gives us the chance to understand what brought them to the ED and what supports they're looking for towards their recovery. We then continue to follow up with the person for as long as they will let us. We call them monthly or more often if requested, and to meet them where they are in their recovery is what we're trying to get to in the follow-up, and listen to what supports they want at that time. This could be a connection with community RCOs, resources for recovery residents, information on meetings such as 12 steps or all recovery meetings, or simply supporting them by listening and sharing our lived experiences. Some of us have been talking with our peers for the entire time that we've been on our program, but there does come a time when we have to close the account after we've repeatedly reached out to a peer and can't get in touch with them. But if they come back to the emergency department, or if they reach out to us by phone, we can start to support them again. And the expectation that we have is to continue to instill hope and navigate a person to recovery. So like Ashley mentioned earlier, we've seen many successes working in these teams over the years. We've also seen many tragedies, from overdoses, alcohol-related health issues, domestic violence, dual diagnoses, severe car wreck injuries. And with trying to come back from COVID, we've seen the effects the isolation and lifestyle changes have had on addiction and mental health of our peers. For me, as the program manager and the others here, I support other coaches that experience the same things that I do in their encounters. So I listen to my coaches give a summary of the encounter as to what brought the peer to the emergency department, how they connected with the peer, their hopes for the peer, and sometimes how the peer didn't keep in contact with them or decline services altogether. And while I want to give encouragement to them, sometimes it isn't appropriate, and I just have to listen and validate what they are feeling. These coaches sometimes see up to, each individual coach can sometimes see up to 5 peers in a day, but we all continue to strive to continue to take care of each other daily in order to continue to show up for our peers in the ED. So thanks for hearing our program overview. And now I'd like to pass the introductions over to Renee.
Thank you, Dawn. So my name's Renee Smith, and I am the B Corps program coordinator. But most importantly, I am a woman and mother in long-term recovery. And what that means for me is it's been over 5 years since I have allowed substances or mental health challenges to control my life. I have 3 wonderful, beautiful children. Their ages 15, 10, and 4. Today, I'm able to be a responsible parent. I'm a role model, and I'm a nurturer. I attend school functions. I go to baseball games, basketball games, after school activities, and I'm able to give my 2 older children the stability that they needed for so many years. I'll celebrate 16 years with my husband in October, and that's because of recovery. I'm reliable, I'm trustworthy, and responsible today. I show up when I say I'm going to, and I strive to continue growing each and every day, and I feel like that is one of the biggest gifts that recovery continues giving me. I speak out about recovery because we all deserve wellness. I combat stigma by sharing experiences and advocating for others. I'm really grateful for the opportunity to be here with you all and to continue building up our workforce together. So I started peer support work with GCSA as a NICU peer recovery coach almost 3 years ago. There's been many instances working as a NICU coach that has affected me. I've seen many successes. I've seen mothers keeping their families together, getting their children back, and just seeing families restored. But I've also supported mothers with their child's passing, through the time and the process of them not having their children, adoptions, having their parental rights terminated, and many other challenges. And since I have lived experience with having my 2 older children in foster care, it's very healing for me to be able to walk alongside them. Peer support is something that I didn't have myself, but it's something that I can be a part of today, and that means a lot to me. And then I had the opportunity to help with the inception of our B Corps program, or Building Communities of Recovery, which came after the emergency department and NICU direct services programs, as an opportunity to continue bridging gaps and building up community support and recovery in Northeast Georgia. So I've been the coordinator for the B Corps program for almost a year now. We'll be starting our 2nd year on in just a few days, June of 2022. So as you see, Amanda Williamson is our peer recovery coach along with myself. So what we do is we support people that come into the emergency department of Lumpkin County, and pregnant women and mothers who are referred by Hall County Department of Family and Children's Services and Hall County Family Treatment Court. We also provide training on substance use disorder and recovery, and that's part of the work that we do under our B Corps project. And we have successfully trained 41 Hall County DFAC staff over the past year. So we're a 2-woman team on B Corps, but all of our direct services teams are working in Northeast Georgia to build up community collaborations and recovery. And I speak for both Amanda and I when I say that walking alongside our peers is rewarding. It can also bring back our own traumas and sometimes heavy burdens. As a manager of our B Corps program, I do my best to offer support by listening, offering suggestions if that's something that they're looking for. Just being present, available, and there for other people's needs. We have one-on-ones. We talk about difficult encounters. We work together to brainstorm ideas of resources that our peers may identify as needs. And we are able to celebrate successes together. So I'm very fortunate to have support from everyone here at GCSA, especially our direct services teams, because being in that crisis in the moment can sometimes be challenging in so many ways. I will share some of my personal experiences and how they have affected me in just a little bit, but at this time, I want to pass that over to Jeremy Moore.
Thank you, Renee. Hello, everybody. My name is Jeremy Moore. I am the Alcohol Use Disorder Program Manager here at the Georgia Council on Substance Abuse. On the screen, you will see two of my superheroes, AUD Recovery Coach Greg Gardner and my case manager, Art Gallegos. Soon we'll have another team member, Richard Mercier, will be joining us on June the 3rd, and my team will be complete. I'm also a person in long-term recovery from substance use disorder and other mental health challenges. In February of this year, I celebrated 9 years in sustained remission. I now get to be an active participant in my own life. I'm an active member in my community and a contributing member of society. Today, I get to be an example of what recovery looks like. My personal recovery is not anonymous. I want those who do not understand us to know that recovery is real. I want our peers who haven't found recovery to know that recovery is possible for them too. My life today is dedicated to making sure that my peers, our peers, do not have to find their way out of that darkness alone. I am a certified peer specialist in addictive disease and also a medication-assisted treatment specialist, and have more than 18,000 hours of on-the-job experience in the field of recovery, working directly with peers and the peer workforce. I have been working for the Georgia Council on Substance Abuse for almost 3 years now. I started as a recovery coach in the emergency department in July of 2019, and in August of 2021, I received my promotion to AUD program manager. Prior to my employment with GCSA, I spent 6 years working in management positions in South Florida treatment centers and detox facilities. I worked alongside medical professionals and licensed clinicians who provided quality care, but did not fully understand the individuals they were serving. In my position, I also supervised many peers in the workforce and saw firsthand the impact the work had on their lives in recovery. Today, I get to work for the Georgia Council on Substance Abuse, an organization made up of peers who support person-centered individual recovery pathways. An organization whose mission is to increase the impact of recovery in our communities by providing education, training, advocacy, and direct peer support services. I knew right away this was my dream job. I will never forget the feeling I got when I learned that my job was to meet peers where they were, approaching them with love, kindness, compassion, empathy, and a genuine sense of understanding, going into every encounter with no agenda and no expectation of any particular outcome. I get to be who I am and give space for my peers to be who they are. I get to use my professional tools to help my peer identify their own recovery goals and pathway, and then support them in achieving those goals, empowering them to decide what recovery looks like for them. The AUD program I manage today was born out of necessity. Due to funding restrictions in 2021, the emergency department coaches were no longer able to see peers with alcohol use disorder. I was one of those coaches. This sudden change excluded roughly 1,000 peers a year from receiving peer support services. GCSA acted fast and wrote a new grant specifically for individuals experiencing alcohol use disorder. The grant was approved, and we were once again able to provide peer support to all peers with alcohol use disorder. And we came back bigger and better. GCSA expanded the program to provide medication-assisted recovery with wraparound services to a limited number of peers each year. The AUD medication-assisted recovery program services include inpatient detox, treatment vouchers to sober living facilities, monthly healthcare checkups, monthly extended release naltrexone injections, weekly counseling with a licensed clinician, case management services, peer coaching, and transportation to and from all program-associated appointments, all at no cost to the peer. Through this pilot program, GCSA hopes to make an impact on the future of alcohol use disorder recovery. Alcohol is often seen as less dangerous, when in reality, alcohol-related injuries and deaths far outnumber those related to other substances. This program seeks to promote that alcohol use disorder is just as important to address as any other substance use disorder. Since our program launched in August of 2021, we've seen more than 400 peers in the Northeast Georgia hospital system and enrolled 15 peers to date in our medication-assisted recovery program. I look forward to sharing more about my experience working in the field later in the presentation. Now I'm going to turn it over to Dwayne and Chastity for our first poll question.
And the poll question's been launched.
Okay, the poll question is, which option best describes your role in the peer workforce currently? Just another minute. Everybody get your answers in.
Seems like majority is going to providing peer coaching in a non-crisis environment. Second, we got providing coaching in a crisis environment. That's funny because they're like direct opposites. We got supervising peer coaches, management positions at 17% so far. Couple people working in the CSU. Okay, it seems like the lowest percentage is not currently working in the peer workforce.
All right. So 31% said providing peer coaching in a non-crisis environment. Let me share the results. So 30% said providing peer coaching in a non-crisis environment. 28% said providing coaching in a crisis environment. Next, looks like we have 18% said working in a treatment center, CSB or CSU. Next will be providing peer, 20% said providing peer support at a recovery community organization. 18% said supervising peer coaches / management position. 13% said not currently working in the peer workforce.
So
That's-
why? Oh, go
Okay.
ahead, Don.
I just wanted to ask, does anybody have any questions or feedback concerning this poll question that they would like to ask or share? Let's see.
We got
Yeah.
one hand raised.
We have one.
I'll let Lisa share. Hold on 1 second. All right, Lisa, you've been promoted. She should be coming in. Do. Lisa, you should have received a message promoting you to a panelist. Maybe not. So with all the other options that you could have chose, is there anybody currently working in a crisis environment and maybe wants to share on it? Just feel free to raise your, Samantha Presley. All right, promote the panelists. There we go. We can hear you.
Okay, can you hear me?
Yep. Well, we can see you too.
Okay. So I work two different jobs actually as a peer support specialist. I was CARES 34. I started off in a recovery community organization called the Divas Who Win Freedom Center. I went from there to Alliance Recovery Center, which is an OTP clinic. And then I have a part-time job working, carrying meetings into the crisis unit at Advantage Behavioral Health. So that's currently what I'm doing now. I have two different jobs that are kind of opposite from one another. The main reason I wanted to do peer support in the crisis unit is a lot of times when I was at the RCO or when I'm at the OTP clinic, they have, we have peers that come in and I'm not allowed. There's times when they need a higher level of care, and then we would call Advantage Behavioral Health to help transport them to the crisis unit. And I was very curious as to what that next step looked like for the peer. So I reached out to Advantage. They brought me on, and I can honestly say that I have two very fulfilling jobs that help me fulfill my purpose. So
Thank you, Samantha. I appreciate you sharing.
yeah, absolutely.
Anthony, how about you? Lisa, you're a panelist if you wanted to share. Anthony, you've just been promoted to panelist.
Hey guys, I'm sorry. I don't know what's going on here. I'm having some problems with my laptop. Can you hear me? And I'm looking really big.
Yep, we can see you. You
Okay.
look great.
So I wanted to come on and share because I noticed that my poll was crisis and non-crisis. So I work for Mercy Care on the street medicine team. I have a caseload of 32. I started out as a peer support specialist and somehow ended up taking on case management work. And we have crisis and non-crisis. And so today's wellness group, I really needed this today because last week, Friday, I was told to zip it by a psychiatrist on the team. And I actually was advocating for a woman that had just gotten her 13-year-old daughter back. The child had been passed around through institutions but kept within the family. So she'd never been brought into DFACS care. The little girl's 13, she has cerebral palsy, along with some behavioral diagnosis. So as soon as I presented it to the team, it was like, I work with clinicians. It was like, did you contact DFACS? So I'm like, contact DFACS for what? What am I contacting DFACS for? She just got the child on Monday. It's just Friday. She hasn't done anything. I mean, she is very much so actively using, which 18 out of my 32 are not in recovery. So I've had to flip the hat and put it into harm reduction. So I just wanted to know how anyone else would have handled this, because it's going to be Friday, and every Friday we have a huddle. So I'm getting ready to go back up against this psychiatrist who has yet to apologize for telling me to zip it. You know, when I really was advocating. I mean, when are we stopping the stigmas? Because we haven't given her a chance. She hasn't done anything to warrant DFACS or someone calling the child abuse hotline.
Got you. First, I want to say we appreciate your peer, you know, advocating for the peers in this workforce. So thank you for that. And as far as your question being answered, there's going to be contact information at the end, and maybe one of the staff will be able to better assist you and guide you through what you're going through. But thank you for sharing your experience.
Well, and I also think that Mercy Care, I really would like to set up something where the Georgia Council would come up and speak to some of the teams at Mercy Care, because clinicians and peer support, I'm telling you, it's gone every day. It's something. I've had a therapist tell me one day recovery was nothing.
Wow.
excuse me, 1 week recovery. I mentioned, she's relapsed a few times, but I mentioned that this particular peer had a week in recovery. She actually overheard the conversation on the phone where the peer said, Miss Lisa, I've got 1 week, I'm in a program. And she said, 1 week, 1 week is nothing. And like blew my mind with that. So it's like every day I go through this with the clinicians.
That'll be perfect. Reach out to me on that one too, because that'll be a great opportunity. We actually
Yeah.
started a new training called Compassionate Conversations that we've been taking to schools and took it to the human resources at the Kia plant. So all of this, that would be good. Just email me.
Yeah,
I'll put my information too. But we got to get back to this presentation. So I'm
Okay.
going to turn it over to Don. Thank you, Lisa.
Great. Thanks, Dwayne.
Yeah, thank you, Lisa. Thank you for being so honest and talking about something that you're going through. So let me carry on here. So we're all here today to talk about the impact of working in direct support services. And we've heard and had webinars on self-care, burnout, and compassion fatigue. But today we'd like to frame it a little differently. We would like to know and hear, how are you doing with working in direct peer services? And Lisa just did a fantastic job of explaining that. That's what we're looking for today. So how has working in crisis and with hard encounters or seeing the increased overdoses impacted you? An additional objective is, how can we start to take a collective approach to taking care of each other in the peer workforce? So you can see, you've been looking at this slide that we have here. I recently read an article from the Harvard Business Review about reframing wellness away from a self-care only approach, and have included the link here. And don't worry if you can't read that, because we didn't get it out of blue. It will be on a resource page at the end of the webinar. So this article suggests giving space to collectively talk about challenging times and, quote, help one another process the emotional fallout from adversity. This is the topic that we're here to speak to today as well. And to quote the article further, it says, human well-being is not achieved alone, and our psychological health is grounded in attachment and acceptance by others. And rather than focusing on self-care, we need to be better at taking care of each other. And this begins by framing distress as a collective rather than an individual problem. This article's research also suggests that when groups frame distress or adversity as a collective rather than an individual problem, the resulting communal coping strategies bolster genuine connection and better recovery. So in addition, Dwayne is going to attach a compassion fatigue worksheet in the chat, and may possibly give you another handout about working in the helping field, and it has a self-care tool framed around an impact model that might be helpful for you. So now that we've introduced ourselves and we've talked about the objective of the webinar, we want to share with you what we do in the hospital, what we have seen, and how we process times of stress from working in the supportive field. So I'm going to pass it back to Dwayne and Chastity for poll question number 2.
Okay, poll question number 2. How confident are you in this moment to maintain your recovery and well-being in your current role? Okay. Looks like everyone is saying confident and 100% confident. Okay, I think we got everybody. We're going to end the poll, share results, and 66% said confident and 34% said 100% confident. Again, does anybody have any questions or comments regarding poll question number 2? If not, we're going to move right along. I don't see any. Okay.
All right. So these numbers here are from the beginning of the emergency department program in 2017. And all the people on this webinar, the panelists for this webinar that are managing other teams, have been coaches on this team and are a part of the support for all of the numbers that you see here. There's a lot of things going on inside of those numbers, but remember, each one of those numbers is an individual, and a lot of experiences happening with that one individual. So from the encounters listed in these numbers, I myself have experienced secondhand trauma as well as vicarious trauma while working as a coach. I have learned that repetitive trauma encounters do constitute as compassion fatigue. So on to what I've seen and how I've processed the stress. I remember this one time that I saw a person that caused me emotional and physical trauma in the past in my past life in an encounter. And no, I didn't know it before I walked into the room, but I was well aware of it when I left the room. During the encounter, the person kept apologizing for specific things that had a negative impact on my life. And that person said, I should have taken up for you and I should have treated you better. And I want to tell you that that was like a punch in the gut, but I handled it with as much grace as I could muster while on the scene. I did begin to cry during the encounter, and I explained to the person that that was a long time ago and I'm here to support you towards making your change. When I walked out of that room, I remember I was holding my breath. And I left the hospital, I got in my car and I drove for a while, and I reminded myself why I do this work. I can remember the impact that that moment had on me was I felt like I went back in time and I questioned if I could do this work. Like my mind went into a warp and immediately my emotions were weakened. But you know, 20 years after a traumatic event occurred, I was able to be the support person for that individual. And to me, that success, it was quite altering at the moment, but looking back, I feel good that I was on the scene to be that person there in that moment. And I did later talk it out with my friends and my coworkers. And yes, I did follow up with the individual and continued follow-ups for as long as they went on. Also, I have seen people that have been disfigured from car accidents due to their substance use, whether it be a car accident or other miscellaneous injury. Seeing people on the medical floor is hard. It's like visiting a family member in the hospital. I've seen families that were in complete exhaustion looking for answers for their very family member that was there in the ED to get recovery. I have seen professionals stigmatize patients in their most vulnerable moments. I have felt the frustration of seeing a peer many times in the ED to only want to support them and for them to get recovery. I have witnessed many people in severe psychotic episodes from substance use. I've seen people tied down in 4-point restraints against their wishes. I've talked with people that were so emotionally tormented that all they wanted to do was die. And the impact of these moments will forever resonate with me. And many times, some of what I saw or what I have seen, it was me at one time. I start to remember my own traumatic experiences. And I'm a verbal processor. I have to process things verbally. But these moments do swirl in my head when I am alone. Just speaking to someone about what I saw and how it made me feel relieves me of the swirling thoughts and continued empathy I feel for a peer long after the encounter is over. The follow-up calls with a peer give me a great opportunity for a coach to see the positive change a peer has made since an encounter. And staying in connection with them brings witness to their recovery, which is the most rewarding part of the process. We've all supported people towards a recovery, and we have wept with grief when things didn't go as we hoped. We as a team talk about these losses to heal and understand we are not alone in how the work can sometimes make us feel. People call it burnout and compassion fatigue, but I feel it's just a human response to all that we see every day. I have read many, many articles this year about how people are collectively talking about painful feelings instead of trying to suppress them. And this is all in order to unburden themselves and heal together. After all, we are in the business of peer support and we are striving for wellness. And that also includes talking about the difficult moments to overcome the trauma of them. I have a great team of supporters and a great organization that allows me to bring my whole self to work every day. There are days when I have great energy and days that I have to cry out my own emotions. Taking a self-care day is good, but you don't get to decide when you feel something. My coworkers have listened to me, they have given feedback, and they've shared their distress with me. And the support within the team is what keeps us all going collectively. So now I'd like to bring back Ashley.
So if I could set the scene for just a minute, I'd like to do so for you guys and gals tonight. All right, so picture yourself as a peer recovery coach working within the hospital. And you get a call to go see a peer. And so you're eager to go and be present, listen, and maybe even share some of what your experiences have been to possibly give hope, even if just a little bit, and help them find in their recovery. All the while not knowing what you're fixing to walk into. Because let's be honest, we've all got stuff going on in our lives, and nobody knows from one person to the next what someone else is dealing with. Some are more catastrophic than others, and some are just, situations. So you walk into the room and you're ready to give it everything that you've got to support this peer, only to feel almost crushed immediately. See, not only is this peer someone who can't have a conversation with you because they're intubated, they are in the end stages of liver failure and entirely yellow in color at this point because their alcohol use has consumed so much of their life. They're also someone that you know, and not just someone that you know from, out on the streets or in the community. This is someone that you went to school with, someone the same age as you. That is something that I experienced firsthand. I walked into a room ready to support and soon felt completely depleted. Watching someone I knew personally lying there dying, and the emotion that poured out from his mom, knowing that her son wasn't coming back, it was very saddening. And it was in that moment that I had this realization that the disease of addiction is really, really real. Even alcohol. I mean, I knew that alcohol use was bad, but I've seen deaths from, overdoses and stuff like that more so than I had alcohol use. So in that moment, it hit home for me because this wasn't a stranger. There were so many emotions, and I felt every bit of it to my core. I was saddened, and after a lot of tears and talks with my friends and coworkers, I was able to process all these emotions and talk things through. And then at the same time, it was at that time that I knew that this is what I wanted to do. I wanted to help people find their recovery. Even though this was a sad situation, I wanted to keep showing up because if I can help support them in finding their recovery, getting on that journey to their wellness, in turn, that will also keep moms from losing their children, brothers from losing their sister, and children from losing their parents. the story that I shared in the beginning of this webinar, that was, just a little small success, or a short story of a success. It wasn't a small success. All successes are big successes. But I shared that because those are the moments that I hold on to because of things like this that we see more often than not. So there's a quote, you'll see it on the slide. It says, once the storm is over, you won't remember how you made it through, how you managed to survive. You won't even be sure, in fact, whether the storm is really over. But one thing is certain, when you come out of the storm, you won't be the same person who walked in. That's what this storm's all about. Oh, thank you guys for letting me share. I'm going to pass it over to Renee now.
Thanks, Ashley. So the reality for me is that there have been many encounters where I didn't process my own feelings or emotions for weeks or months after those encounters themselves. And that's not counting for all the follow-ups made through that process. But there are some things that I came to a realization were correlations with my work as a peer recovery coach. And I believe that those are secondary trauma that spilled over into my home life. So one specific thing is parenting my children out of guilt. So after a while of working as a NICU peer recovery coach, I came to the realization that I had began parenting out of guilt once again. And this is something that, I had to work through when I got into recovery. So early in my recovery, I worked through this. I thought that I, had it handled. But this time it was directly related to supporting other mothers who were losing their children. It was just the constant reminders of what I went through, invasive thoughts of, like how my children must have felt, guilt and shame. And then, those extreme feelings of empathy for the women that I walk alongside, and just feeling those feelings with them. But one thing that has helped me combat these feelings is speaking out loud about it, exactly as I see it. And with GCSA, this is something that I'm able to do without feeling that I'm being judged or that I'm not capable of doing my job. Because the reality is that I have the empathy that I do because of my experience, and it allows me to connect with other mothers and other people on a level that not everyone can do if you haven't been through it. And I feel like this is the reason for my quote unquote trials of life. It's just part of what I was meant to do. And for me in this specific situation, as far as parenting, out of guilt, it was realizing that change. It was realizing that I was doing it, that I needed to evaluate taking my work home, and how peer support can actually spill over into my personal life if I don't take care of myself and I don't keep the two separate. So, having a supportive work environment like I do here, it's allowed me to process things and just let it out and talk about it. And then, just like anything else, just having other people share their experiences and their thoughts, and not feeling alone, it's empowering. So, I've been able to process it, and I'm no longer parenting out of guilt due to my past or working with other mothers. And these are things that I need to be able to talk about. I don't necessarily need someone to fix it because it's something that I've worked on before. It's just speaking it out, knowing that I'm not alone. It's that aha moment for me. And there's been other situations at work in the peer workforce, but this specific situation was definitely a turning point for me. It allowed me to get into a solution, to really start separating my work and my home. And I believe that having space for the peer workforce is something we all need, because there's only so much we can do without the support ourselves. And sometimes it's not necessarily that we don't have the support. It's just jumping on that boat with each other collectively, just as we do with our peers. And that's something that we are hoping to establish with this webinar with you all today. And I shared a quote here: overcoming difficulties leads to courage, self-respect, and knowing yourself. That means a lot to me. So at this time, I'm going to pass it back over to Jeremy.
Thank you, Renee and Ashley and Dawn. You guys got me all emotional over here before it was my turn. So I spoke to you guys a little earlier about working in treatment centers alongside medical professionals and licensed clinicians, being a part of the treatment team, but being the only one at the table with lived experience in active substance use and in recovery. As an employee and a manager, I often found myself in conflict with my core values and ideals about recovery, the needs of the organization from a business standpoint, and the agenda of the treatment team, which oftentimes it was my job to carry out and present the decisions made by the treatment team to the peers, me and my team. There were specific expected outcomes, and most of the time it included getting the peer to do something they did not want to do, or convincing them to stay in treatment when their illness had already decided they were leaving treatment AMA. There was a tremendous amount of pressure on me and my team of techs, most of whom were in recovery. And to achieve the desired outcomes, our performance and effectiveness as individuals as well as a team were judged based on our success rates. There were some very tough times during this period when I felt like I was breaking down and did not have a safe outlet to talk about the impact the environment was having on me. It affected my mental health, my physical health, my sense of well-being, and even my sleep at night. Self-care was not enough. Personally, I never considered or saw return to use as an option. However, I witnessed many of my employees return to use or abruptly quit their jobs in the middle of a tough situation because the pressure was too great. I witnessed my staff go from energetic, passionate individuals standing ready to serve peers and help others find recovery to overwhelmed, stressed, emotional, and insecure in their abilities. The turnover was high and was referred to by human resources and executive leadership as the burn rate. It was often said that techs had an expiration date. This was expected and it was planned for. Part of this work, as I alluded to in my opening, requires that we meet our peers in the presence of their pain, sitting with them in the dark place, exposing ourselves, or if you will, revisiting the darkness that we used to live in. This is different from the stress and pressure that I just shared about. Daily exposure and direct contact with peers who are in crisis, and being that person that takes it all in and guides the peer through their pain and hopefully a plan for their own recovery pathway, can often affect one's own well-being in many ways. These hard encounters can weigh heavy on a coach over time. I want to share a quick story about a recent encounter. This was within the last few weeks with a peer in the emergency room. As an emergency room recovery coach, we never have any idea what we're walking into. On this particular day, I walked into the room to provide support for a new peer. I quickly learned that we had a lot in common, including a shared sober living home that we had both stayed at. I spent many years of my life in that center going through refresher courses and many shared friends in our circle. I never expected to learn during this encounter that 3 people with whom I was close had passed away within the last few months. One was a peer that I had recently worked with and I had been trying very hard to reach. One was a man that I had sponsored, and the other was a man that I had known for about 20 years. I had to hold it together for the peer I was supporting in front of me. When I got home that night, I spent the evening on the couch crying. And during my morning, and while I was reading their obituaries, I received a message from our executive director, Neil Campbell. Her message of support could not have come at a better time. I was able to respond to her and let her know how I was feeling, and that gave me some much needed relief in that moment. The most difficult encounters for me are those with peers in extreme poverty, with medical conditions barring them from being admitted to most treatment facilities or sober homes, those with disabilities living on the street and living on an extremely low fixed income. Most of these peers have no support system whatsoever. Listening to their tragic stories, feeling their sense of hopelessness, and knowing that all I have to offer them is my support and encouragement. This is if they have a phone and I can reach them. We work in the hospital system with peers in an innumerable number of medical and psychiatric crises, some situations being unimaginable until you find yourself right in the middle of it. Hard encounters can be really hard on us. This weight can become overwhelming at times, and without being able to regularly process our experiences and talk about how we are really feeling, we can find ourselves completely drained and much less effective as a coach. There's a quote from Brene Brown that you're going to see. I have found that there have been times when I didn't give myself room to be human, expecting that with the length of time I have in recovery and my professional experience that I should be stronger. I should be able to handle anything. I know today this simply isn't true. I am a human with limitations. I know that it's okay to not have the answers to every situation. I know that there are times when sitting with a peer in their pain, in that awful dark place, may be the absolute best I can do. And at the end of the day, maybe that peer's dark place was just a little bit brighter when I left. I'll turn it over to Dwayne now, I believe.
And I'll be short, but what everybody said so far has been great, man. Powerful stories, and thank y'all all for being vulnerable in this setting. But I think about before I had this job at GCSA, I wanted to be, I just wanted to work in the recovery field, anything as soon as possible. And I got that opportunity at this crisis unit. And the position I got to start off with was security. So just doing takedowns and stuff like that. But I eventually worked my way up to becoming a CPS and then a CPS lead. And that's when things got a little tricky and I had to provide peer support and still do takedowns. And it just got, so we served clients that were labeled high acuity, or peers who had overdosed being sent to us from the hospital. We had peers that were detoxing off of opiates with extreme withdrawal symptoms, peers dealing with those very dangerous alcohol and benzo withdrawals, peers who were experiencing just bad trips from maybe smoking marijuana and it was laced with K2. Peers who were in meth or cocaine-induced psychosis. We had suicidal ideations, peers who didn't even want to be there. They were just 1013 or 1014, and just dual diagnosed peers as well, just everything all in there. And we had about 3 CPSs that had to take on these cases. And with all these different types of cases occurring on a daily basis, there was something missing. So if I think to myself, what was needed when I was in that position? I was a peer providing a lot of peer support to a lot of peers in crisis on a daily basis. And the answer is I needed a lot of self-care, but more specifically, a lot of self-care in the working environment. Self-care was very obtainable outside of my occupation at the time, but I needed the most during work hours when I was getting spiritually, mentally, emotionally, and physically just drained. And the craziest part of it all, though, is that if you would have asked me the question that you heard at the beginning, you know, how are you today? I probably would have told you I was fine and just kept it pushing because I felt guilty, y'all. I felt guilty. I felt like I was supposed to be happy. I felt like I was supposed to be filled with gratitude that I was working in the recovery field and I was and, you know, I was helping out all of these peers and providing peer support. I mean, it's what I wanted to do, right? So I felt like I couldn't really complain. I almost felt like a professional athlete that can't talk about their injuries. So it was like that for me. And I just couldn't explain to anyone. I was fearful of the negative response, and I just felt like no one understood. You're not doing what I'm doing, so you wouldn't understand. But what I failed to realize is that true growth comes from being vulnerable. I mean, if I'm being honest, that's how I got my recovery. I told somebody what was going on. I admitted to my mom what I was doing. And that's how my journey started. And that's how I maintained it. And now I get to this spot where I'm hiding again. So it should be something that should be obtainable again because I've already done it and it gave me so much peace. I could look at the results that being transparent got me. So what are, you know, what does self-care look like in a working environment? I wish I would have knew the answer to that question back then. But today I'm pretty sure I'm gonna find out. And with that, we'll launch the third poll question.
Okay, Dwayne, third poll question. How many of you ever felt that due to your time in recovery and or the role that you were to fulfill within your organization, it was not okay to not be okay? Okay, just a few more seconds. I think that's it. All right. 69% said sometimes. So a majority of the people said sometimes. 14% said most of the time, 11% said never, and 6% said all of the time. Thank you for your feedback. Now, if anybody has any questions, comments, or concerns related to poll question number 3, you can raise your hand. And we'll just give you about 2 minutes to do so.
And if you do have a story that you'd like to share, we'll have time towards the end if it doesn't have to do with this poll question number 3. And we'll limit people to maybe 2 or 3 minutes just to share an experience. So if you have your stories, save them and we're gonna get to it. Thank you.
Okay, moving right along.
Okay, so earlier you heard stories of things that we have seen, how we felt, and how we processed those emotions afterwards. We are interested in giving you a chance to share some stories that impacted you. Remember, this is an open space, so it is a public forum. It's also a safe place to be vulnerable and share some of your impactful stories. We want to give you a chance to speak freely about your emotions and experiences in tough encounters and traumatic situations, or any feelings after your encounters that you may be carrying with you. This is a space to be heard and speak freely. So Chastity, if anybody wants to, you can raise your hand. You can put it in the chat box. And this is the time for you guys to share your experiences. And depending
Anthony,
on the amount
did you want to share?
There you go.
I know you had your hand raised before. So Anthony, if you still wanted to share, wanted to give you that opportunity. Anthony. Also, I saw that Isidore shared something in the chat saying that Mercy Care has outside people who come in to deliver trainings. If you wanted to expound on that, Isidore, we'd love to hear it. And this is really where we can bounce ideas off of each other so we could, you know, advocate for ourselves in our own organization. So we'd love to hear what different places are doing or not doing. Okay, Anthony said he's gonna try some up. All right, Anthony, I'm about to promote you to a panelist. Isidore, you can share as well if you want to be the one to go next. We got Daniel Williams. I'll promote him to a panelist as well. There we go. All right, Daniel, you could go first. I think Anthony's still working on getting this connection. So you should be able to share your video now because you're now a panelist.
Got it. My bad. I was muted and stuff. So some of y'all might recognize me. I'm a 2022 recovery ambassador. You know, I'm the executive director of Warriors Reprieve, which is a veteran RCO. And I'm one of those 6% who said I've always feel like I have to have my stuff together, that I'm not allotted not being okay. And literally right before this started, I had an emotional breakdown. You know, it seemed like there's a lot of stuff going on, and it hasn't gone particularly great for us, especially some outcomes we were trying to do with, you know, our organization, and just other stressors working with the homeless population in Athens and dealing with one of the companies out there. But the good thing about it is I didn't want to hurt myself and I didn't want to use over it, you know. And then when this came up, something told me like, hey, you need to be on this webinar today. Don't skip it. So I'm glad I'm here. I'm glad to hear your guys' story, and I just needed to share that. So thanks.
Thank you, Daniel. You said the key word needed to. You made it a thing in your recovery that you need to let go of stuff like that, or at least bring it up. So I appreciate you getting vulnerable with that. Shows a lot of courage and power in you, and I appreciate it. Thank you for growing this workforce, man. Thank you. Anthony, it's on you.
Okay, let's see if it's gonna act right now. Sorry, y'all. I hadn't done my hair, so be patient with me. I'm a person in long-term recovery. My name is Anthony Gray. How am I really? I think I'm in a better space now. It's like I said before, not all days are gonna be sunny and bright and everything. I just have to remember the tools that I use or have. Holidays are still kind of trying to me, but I have a support system, and in the job that I work, I thought it was going to be more stressful, but one of the things that they pride themselves on is self-care, especially amongst the peers. And last week I told my boss I was really this is the time where we really get a chance to just open up and talk. So I've never really done this at my last job. I told them how I felt, and it wasn't okay to not be okay at that time. So when I said, look, I'm really stressed, I'm really just tired, I'm getting burned out or what have you. Oh, we'll go take you a break, 15-minute break, 15 minutes. No, I'm dealing with clients who are having issues. I'm dealing with staff, I'm dealing with this, home issues, all this other stuff. So I'm in a good space now. I'm in a really good space because I get to go and be open and honest with my boss and say, look, mentally right now, I'm not feeling it. You know, the holidays just passed, Mother's Day passed, my mom passed, and we were just building the connection, and that's kind of trying on me. My godmother passed. on this month as well. And this was the month that I graduated college and she didn't get a chance to see me walk down the aisle. That hurt me. So it was a lot of stuff. But now being able to use my network and also being a peer, using that network and then mirroring that onto my current clients that I have, gets a chance to show them that recovery is possible. One of them, as a matter of fact, and this is just perfect timing, one of my clients told me 2 hours ago when I went on the floor, he saw me and said, look, man, I'm really gonna try this time. I said, I know you can do it. He said, that's the thing. Nobody ever really said, I know you can do it. They either said you better do it or oh, you ain't gonna have it. He said, and to actually see somebody doing it, that's different. So I gave him the number to the office and told him to give me a call. He was like, he didn't have any support. He didn't have any support in the area that he was in. I gave him the number to an RCO. I gave him the number to my office. I said, all right, now you got a starting support network and you can build off of that. So I thought it was going to be difficult becoming a peer. I was really anxious to become one. When I got into it, I found out this is one of the greatest blessings that I've ever had, to be honest with you. Thanks for letting me share.
Thank you, Anthony. Become a peer. You was already a peer. It's probably just natural. But thank you. I think we got to push forward, but if we do have time at the end, Amanda will be next, and then Gregory.
Okay, so I'll try to be quick, Dwayne, and we'll keep moving on. So collective healing comes after collective trauma. It heals trauma and secondary trauma. So what is collective trauma? It's a psychological stress that a group of people or an entire community experience. And the shared reaction to traumatic events can influence the culture of a community. People experience challenges differently and have unique viewpoints about trauma. COVID has brought collective trauma to healthcare workers and other service providers in the hospital system. And the new ways people are coping with these traumas have increased the number of people seeking support for addiction, people that didn't have an addiction before COVID. I've come across many articles this year, and we'll continue to talk about these through to the end of the webinar, which is almost here. I'm going to move as fast as I can, but I want to talk about Brene Brown's book, the new book, Atlas of the Heart. And in chapter 9, she talks about the title is Places That We Go when we're searching for connection. And she speaks about Maslow's hierarchy of needs. And she writes, recent research shows that finding a sense of belonging in close social relationships and with our community is essential to well-being. Peers in the workforce attend small social gatherings at 12-step meetings, but would it be supportive to have specific, diverse, small groups for the workforce alone? For example, groups for coaches working in mental health only, groups for coaches working in crisis, coaches working in hospitals, coaches managing peers, veterans coaching veterans, etc. Brene Brown talks about her feelings of not belonging with her family. And when she talked about it openly and the other family members were able to talk about it, they learned that the majority of them felt the same way. So what she found was once they were authentic with their vulnerable feelings, most of the family felt the same. So we're here today to hear from you and ask from you, what do you need and what do you want to do to support the workforce? I want to process these encounters as often as possible to heal and unburden myself, ourselves, if necessary, and wonder if other recovery coaches, especially coaches working in crisis, want the same. Another quote from the article from the beginning of the webinar is, knowing others are struggling also helps free us from the shame. There's no more capacity for clear thinking and problem solving. There is more capacity for clear thinking and problem solving once we know that. And at the end of the article, it says that in the deepest sense, members become part of a group that cares for them as the unique, flawed, struggling, but valued humans that they are. And there's no more essential foundation for wellness than that connection. So Chastity, next poll question, I believe.
Yes, that is correct. Next poll question is, how many of you are willing to play an active role in creating environments conducive to collective healing for the workforce? All right, just a few more seconds, guys. Answers are locked in. Okay. 29% said I want to, but I'm not sure how to go about it. 14% said I want to, but I'm so busy that I'm not sure I will have time. Also, 14% said I'm not ready to get involved with this initiative at this time. And the majority of the people said I am in and ready to act now. 43%.
So for everybody that said that they were willing to act now, or they wanted to, but they didn't know how to go about it, or they weren't sure they were going to have time, if you guys would please put your email addresses in the chat box so that we can connect with you later. We're going to share some ideas here shortly about ways that we might be able to create those types of environments. So put your emails in the chat box if you are one of the ones that answered that you wanted to get involved at some level.
Yeah, so quickly, we want to add that our organization has implemented several employee supportive benefits. And these benefits were the result of executive leadership, listening to this workforce and developing an action to plan to meet the needs of our staff. One of the first things you see on the list here is wellness days. We do get 3 extra wellness days per year on top of our earned PTO, just for us to set aside for our own self-care and wellness. We also have luncheons. We have team luncheons. We decided as a team that we wanted a time where we could get together, be present with one another, and enjoy each other's company without having to talk about work. So once a month, they plan to go out. We've all planned to go out and do lunch. And as a matter of fact, that happened today at 11 o'clock.
And then we have twice a week team check-ins. So Tuesday and Thursday at 4 o'clock, all of our direct services teams, that's emergency department, AUD, NICU, B-Corps, we all get together and we talk about what's right with us, what's going on, what went on over the weekend, what we're gonna do for the upcoming weekend. And that's where we're able to share on any hard encounters or anything that's going on that we just need to get out. So it's really helpful for us as a team.
Yeah, we also have an EAP program, employee assistant program by Balance Works through our paychecks. It offers 24/7 access to a phone call for counseling, 3 free counseling sessions, a wellness program. It also offers things like a dedicated personal assistance. What else? Legal and financial consultations and things like pharmacy discount card as well.
And we skipped health insurance, but GCSA also provides us with affordable commercial health insurance, which allows us to not only maintain our physical health, but it also includes adequate behavioral health coverage so that we have the option to receive additional professional help through psychiatry and therapy with licensed clinicians if we choose to do so.
And then we have a generous PTO package. So we accrue 10 hours a month. That's 3 weeks a year, along with wellness days that Dawn spoke on. And in addition to our PTO, we also have our federal holidays. And then job counseling. So something that we had talked about in check-ins were, what would be helpful, what would be beneficial. So we're working on implementing job counseling. It's a safe place to, just a safe place to express what's going on and the struggles that we face. This is just something that we needed more. And so we've started the conversations about implementing those, just to give us that little bit of extra support.
All right, and this month we had an all-staff meeting, which was something that we do quarterly. During this staff meeting, we discussed changes made within the organization to better support the needs of GCSA staff based on previous feedback from GCSA employees. We also participated in several activities to garner more feedback and additional ideas on how staff can better support one another. Out of this discussion came the idea of a buddy system, which we implemented this month as well. Each employee is paired with a buddy, and as buddies, we connect with one another regularly to get to know one another and learn more about each other's role in the organization. The plan is for buddies to be rotated and repaired once a month with a new buddy. This is brand new, but I've already heard buddy chatter where buddies are meeting up for coffee and connecting with one another in various ways. So now that we have shared some of the things that we have implemented within our organization, we would like to hear from you about what your organization is doing to create a supportive and safe environment for you. This can include ideas that you have about what might be helpful to create a safe, supportive environment conducive to collective wellness. You can put your answers in the chat. You can raise your hand. Chastity will read the answers from the chat. You can also raise your hand and when we can unmute you so that you can share. So this is, I believe, unless we have time, your last opportunity to speak up and give us some ideas and share what your organizations are doing. So take it away, Chastity and Dwayne.
See, Heather King has a question. Oh, her question's in the chat. How do you build team companionship if your offices are spread throughout the campus in different buildings due to lack of space? Does anybody want to answer that? I think Renee raised her hand.
Oh, I didn't realize I was unmuted. Well, I mean, I think that's a lot of the buddy system that we've created, because that's how it is for us. We have office here in Gainesville. We've recently all come into one office, like the direct services, but the NICU and the B Corps team was separate. And that's something that those check-ins really help with is, us all being able to come together in one spot. And then the buddy system, there's a lot of people that work in Atlanta or are working from home. And then we have us here, that are going in the multiple hospitals. So kind of creating that buddy system, and we're assigned somebody a month, and then we get to know them, and they can learn about what we do and we can learn about what they do, because it is hard when we're being separate, like when we're all in different places, to know exactly what's going on and to get to know people. So maybe that's something
Thank you, Renee. Appreciate it. And then we have Amanda, and we're going to go over, folks. So we're approaching 6:30. If you could bear with us 5 more minutes, 6:35, we'll be out of here by then. Amanda, did you want to share really quick?
Well, I was going to share earlier that it's not really about what y'all are asking about, but it's, I don't know, I had an epiphany as I was listening to this. I'm Amanda, I'm a person in long-term recovery. I'm a peer recovery coach with Renee under the B Corps. Renee's my boss, and I'm very blessed to have her as my boss. But I had an epiphany listening to y'all, even though I'm with y'all every day, but I needed to hear it. And I think today, like with the peer that I was supporting, because her situation is so similar to mine and her children are the same age mine were. She's in the hospital for the same things that I was in, her children in foster care. And like, I'm listening to y'all talk and I'm like, Amanda, what were you doing today? Were you trying to save her or were you trying to save yourself? And I think a lot of times, like I lived through all those traumas and what I went through my peers because the situations are so similar. And I think I'm trying to save myself all over again. And I don't know, it just really hit me and it was deep and I have to reevaluate myself. And I don't know, I'm just grateful I work for Georgia Council and I have such closeness with everyone here that's on this webinar. And there's no one that I can't go to with my stuff because it's tough and heavy sometimes, but that's all that I got. Thank you.
I've never heard it put like that, but it makes so much sense now to think about it. Who's it on? Chastity?
I can go ahead and wrap up if you want me to do closing solutions that we've thought about, Dwayne.
We have one more poll. You want to get through
Oh,
the
yeah.
last? Yeah, hold on, just last poll question will be, after this webinar, how confident are you that you can affect change in your current work environment and on the collective healing of the peer workforce and maintain your own recovery and well-being? Okay. All right, looks like we're done. Okay, it looks like 43% said confident, 30% said 100% confident, 27% said somewhat confident, and we didn't have anyone say not confident at all. So we're pretty confident, guys. That's good. Okay,
All right.
Dawn.
Thanks, Chastity. Sorry, I was like getting nervous about running over time. So we're not experts, but these are some ideas that could be included in a collective approach to support each other in the workforce. We've listed some things here: process group, PACE groups, listening circles, and we've put some links there. As a workforce, I mean, we have a lot of things. We've mentioned the things that help us take care of each other. Do we want to establish process groups, to have the unique opportunity to receive multiple perspectives or feedback like we have today? There's things I've recently been reading about called PACE groups. These are small groups of 6 individuals with one person that's a facilitator. You're matched up with it would look like people across the state, strangers, not like your own coworkers, but matched with people who have other similar life struggles. They have an opener, they have a pause for some meditation, activity and reflection where each person is allowed to talk about things that they're going through and just have a free flowing conversation. And the goal is authentic sharing, deep emotional connection, and personal insight. Some takeaways is their last part of a PACE group is to identify key wisdoms, lessons, or pivotal moments from the session. Something a little different that we've researched are things like listening circles. They provide people an opportunity to speak and listen to each other in an atmosphere of safety, decorum, and equality. They emphasize storytelling for cultivating empathy. It's a closed and safe, compassionate space for you to share your emotions and listen to others that are in similar situations. Link that we put here, Morningside Center talks about listening circles as well, and it gives people a chance to say what they're thinking and feeling and can help form mutual understanding and support among people in stressful situations. Also, a link from the Kelly Work Services there. So these are just some thoughts that we've had because we have so much, but if we wanted more and wanted to hear what's happening with other people in these situations, these are just a few examples that we've come across. And we believe that the commonality is to develop small, safe environments for the workforce to speak on the human experience and the impact of compassion fatigue that it may have on you as a human. So thank you for that. I'm passing it back to Chastity with the closing poll.
We already did it.
Oh, sorry.
No, you're good.
Sorry, folks.
Do y'all want to go ahead? Okay, these are our email addresses, phone numbers for anyone that didn't get a chance to share or has any questions or wants to talk about anything, please reach out to us. Dwayne is going to send out a document as well that will have our information along with all the resources that we talked about today.
Yeah. So don't worry about keeping up with the chat and trying to get the directory and all the resources. I'm going to send out an email to everybody. Okay.
Beautiful.
Everybody good. Thank you again for everybody that came. Thank you for our great facilitators. Y'all did an awesome job. I appreciate it. I'm sure everybody else does too. And y'all have a great Thursday.
Thank y'all.